Several doctors here in France are alerting on the fact that 10 to 15% of patients seem to still experience symptoms more than a month after contracting the virus. And patients are talking about symptoms such as asthma, shortness of breath, but also heart arrhythmia. What's alarming about the situation is that most of these patients seem to be young women without pre-existing conditions. And what's more, most of these people test negative to COVID-19 with no trace of infection in their blood work and normal scans. Now, that doesn't mean they haven't contracted COVID-19, but perhaps they've had a mild form of the virus. Some patients here in France are starting to talk about their situation on social media platforms, and they're saying that some doctors have given up on them because they simply don't know how to treat them when it comes to these persistent symptoms. They're also saying that some doctors are starting to allude to the fact that it could be a mental creation, that these symptoms don't really exist, and that it's a creation of their psyche, if you will, when indeed the most reliable hypothesis that's being put forward today is the fact that it could be linked to an inflammatory reaction of the immune system. Now, these patients with these persistent symptoms here in France are now asking for a very precise standard care pathways to be put in place so that general practitioners know what to do with patients 20 or 40 days after the infection.